Just like having relevant and accurate information is necessary to make sound hiring and lending decisions, being engaged in our community is important. DataFax is proud to support the Positives and be a sponsor of the Spark.
Lipscomb & Pitts Insurance is honored to serve the Memphis community for over 60 years. We've always focused on supporting our community and believe in promoting the positives, encouraging engagement, and leading by example. Lipscomb & Pitts Insurance is proud to be a presenting sponsor of the Spark.
Additional funding for the Spark is provided by Christian Brothers University, Mueller Industries, United Way of the Mid-South, MyTown Movers, MyTown Roofing, MyTown Miracles, and by Serves.
This month on The Spark, our theme is the Plan for Success. We'll learn more about an organization with a Memphis plan for improving health and well-being so people can experience the full richness of life. A nonprofit leading effective community practices to end homelessness in Memphis and Shelby County, and a company famously known for its chicken, its employees saying please and thank you, and its commitment to community. We'll also share a special moment from our Spark Awards 2017. Ever been excited by a new idea? Inspired by watching someone lead by example? When we talk about creating change, we start by sharing the stories of everyday heroes making a difference in their own way so we can learn and do the same. This truth is the power behind this show, which is focused on business and community leaders who are leading by example to give back, fuel change, and create new opportunities for the Mid-South. I'm Jeremy Park, and this is The Spark. They're an organization with a Memphis plan for improving the health and well-being of our community. I'm here with the Director of the Healthcare Advisory Team and Patient Services for Church Health, Andriana Smith. And let's start with Dr. Morris, Church Health, amazing legacy. Give us a little bit of the history.
Absolutely. Well, thank you for having me. Church Health has been around for the past 30 years. So our main focus is to help the working uninsured in our community. So we do that through our network of volunteer physicians and specialists throughout the community, but we also do that with our own providers on staff down at Church Health, our crosstown location.
It's a very unique model. I mean, you have physicians, doctors, specialists who donate their time, which allows you to then do what you do, which is deliver amazing health care.
Absolutely, and we can't do it without them. We are able to serve more people just by having such a generous community of providers here. So it makes our job so much easier.
Talk about this Memphis plan, because this is a game changer, and as you mentioned, it's the working uninsured. So think about how many wait staff, who are coaches, who are, I mean, these are people here in our community who have jobs,
right? But
they don't really make the money that they need to get whatever other health care. So it's like you have a chance to step in and make sure that no one falls through the cracks.
Absolutely. So the Memphis plan is geared towards small business owners. And so we're talking about folks who are mom and pops or startup businesses, or maybe it's just a contractor who's working for themselves and they need a healthcare option. Sometimes insurance plans just aren't the right fit, either from the affordability standpoint, or maybe they just don't qualify to get any subsidies from the government for help. So the Memphis plan stands in the gap for those folks. We're able to help them out. They'll have a doctor, they'll have a hospital that they're assigned to. They're connected to all of our specialists in the community for services, dental, eye, counseling, so the whole thing.
And talk about, me, it's a very small copay, very small price per month.
Yes.
Many of the employers can fully underwrite or help kind of partially underwrite that cost.
Yes. So it's $50 a month for the premium, and most of our employers actually pay a portion of that, about $10. So $40 that's passed on to the employee. And then every time the person goes to the doctor, it's just $5.
That's
so
awesome.
Yeah, it is. It's awesome. Yeah. So you don't have to worry about that deductible or have to worry about what are the out-of-pocket costs going to be if I have to go in for surgery. Everything's taken care of under that $5 copay.
And let's go back to Church Health because, one, you're in Crosstown Concourse.
Yes.
So describe the Vertical Village and what it's like being there.
It's amazing. For anyone who's lived in Memphis for a while and you've just driven past the whole old Sears building and not knowing what's going to happen to it, generally we tear things down, but the fact that so many people came into play to make this thing happen is amazing. So we're working with other retailers, nonprofits that are in the building with us every day. YMCA is a partner with us in fitness, along with a lot of foundations and nonprofits. But then you have eateries that are there, people living in the building. It really is amazing. So anyone who hasn't seen it yet, even if you're not coming to Church Health, just come and stop by and visit some of the retail folks.
Well, and I love the fact that you have ongoing tours that are open to the public. You do it, I think, every Friday.
Yes.
And there's so many things that you do to truly open your arms to bring people in to see what you're doing. Talk about some of the other things. I mean, you mentioned vision. You mentioned, I mean, even healthy eating. There's a lot that goes on with Church Health above and beyond just the typical healthcare side. It's very holistic.
Yes, absolutely. And you don't have to just be a working uninsured person to come in and experience Church Health. We have a nutrition kitchen that people love to come to. So once a month, we do a dining series, I guess, called The Art of Dinner, where you come in and you prepare a meal with a chef that is teaching you exactly how to cook the meal. Those aren't necessarily healthy. Those are more for fun, so you can enjoy it with a spouse or a partner or a roommate, just as a fun night out. But we also do other events. We do meditation classes. We do things to teach your children how to eat healthy and how to be more mindful of your fitness level. So those are things outside of just being a patient of Church Health that you can enjoy.
You know, what you're doing is very unique in terms of when you talk about leveraging the volunteer time, so to speak, of these specialists, being able to pay that forward and give it back and to be able to engage and, you know, really focus on healthcare. I've got to imagine there's a big spotlight that's being, you know, shown on Memphis with other cities looking at this unique model. Share with us from that perspective of what Memphis is doing here through Church Health that's very different that other cities maybe are starting to notice.
Yeah, so we do a replication workshop. So if anyone really is interested in hearing that all the ins and the outs, we share it all. We put it all out there, and you can go to our website to find out just exactly how we do it. But you're right. When we tell people exactly how we're able to serve so many folks in our city, they are blown away. We do have some providers that are on our staff, but the majority of the work that we do is through volunteer providers and hospitals and specialists throughout the community. So without the generosity of all of those doctors and nurses and office staff people who just want to get involved in helping people, we could not do the work that we do. So, I mean, just through the course of the year, we're seeing upwards of about 12,000 patients. Those aren't just folks coming through our doors. They're going to doctors' offices throughout the community, hospitals, specialists. I mean, these folks are seeing them in their office, volunteering their time, their office staff's time, and all of their supplies, just to be able to help our community be healthier.
Well, tell everyone one more time where they can learn more about Church Health.
Absolutely. They can go to churchhealth.org if they want to learn about Church Health, and then they can also go to memphisplan.org if they want to learn a little bit more about the Memphis Plan.
Well, I greatly appreciate and love all you're doing, and thanks for coming on the show.
Thank you so much for having me.
They're a nonprofit leading effective community practices to end homelessness here in Memphis and Shelby County. We're here with the Continuum of Care Planning Director for the Community Alliance for the Homeless, Dana Brooks. And let's start. Community Alliance for the Homeless. Give us some of the mission and the purpose, the history for the organization.
Sure. So Community Alliance for the Homeless is about 10 years old. It started out as Partners for the Homeless and kind of evolved over time. We are responsible for implementing the Mayor's Action Plan to end homelessness. We tackle Memphis and Shelby County. We have a Continuum of Care, which is a group of providers that provide mental health services, homeless services, housing, and just connection to community resources. And we believe that housing is a basic human right for all members of our community.
Absolutely, and when you look at the 2017 stats, and I'll have you kind of elaborate on that, but it was around 1,426 individuals. You do this survey, it gets accredited, but about 6%, if I'm remembering the stats, didn't have homes. Others had some shelter, but not quite. So describe homelessness in terms of how you look at that.
HUD kind of identifies consumers into populations. So you're chronically homeless, which is long-term. You're literally homeless, which is coming from a street, a car, shelter. And then you have youth, which is 18 to 24. You have adults 25 and up, veterans, non-veterans. And so we have resources that are specific to each population. And then of course, while you're waiting to get into those resources and into housing, we have emergency shelter. So all of that kind of works, you know, in conjunction with each other. We have a system in place called coordinated entry. Everyone gets the same crisis response. Everyone gets the same assessment. And everyone is prioritized for housing the same way, and all of that's regulated by HUD. And so we have providers that come to the table every single week to make that happen. It basically starts from the time of identification, whether you call me or use our online siting tool or however you're going to report that person, and then we go out, engage, assess, and then figure out where they can fit into the resources that we have. And with that, we do the point in time count. So we do that every January. It's mandated by HUD, and we go out at 3 o'clock in the morning and survey the streets to make sure that we're serving and identifying everyone that's out there. And so the 2017 numbers are the most recent to date, and so that's where you saw the 1427. Out of those, only 79 were outside. So that means that, you know, our providers have done a really good job of educating the community on where you can go if you're experiencing homelessness. 1,300 plus were actually inside. They were in emergency shelter or transitional housing of some sort. 131 of those were family households. 213 of those were veterans. And so about 849 of those were male, and the rest were female. So there's about twice as many men as there are women on our streets experiencing homelessness. And we just really work hard to make sure that we're working together. So whatever door you walk into when you're having a crisis, you will get the same assistance.
Talk about how the public can kind of help engage, because there is a piece of this where, as you mentioned, in January, going out and being a volunteer for the count, that's one piece of this. The other one is just being an eye and knowing where the resources are and being able to connect to you.
Yes, so there's a 24-hour homeless hotline. It's specifically for family shelter, but anyone can call it. And that's 529-4545. There's domestic violence hotlines. The Family Safety Center has a crisis hotline. All of those are 24/7. And then we have an online siting tool on our website. So our website is cafth.org. And if you see anyone outside experiencing homelessness, you can fill out a little form. You know, have you seen someone? It's a description, location, whether they have a dog, if it was more than one person, your contact information. If they will consent to it, you can upload a picture. And when you click submit, that notifies an outreach worker immediately. So that way we can go out and figure out how and, you know, what they need and how quickly we can get them out of that situation. Nice. And then we also do a yearly event in addition to the count called Project Homeless Connect. So Project Homeless Connect is a massive event. We tend to do that at the Cook Convention Center. We do it September, October, so keep an eye out for that because we need hundreds of volunteers. And it's basically a one-stop shop. 9 to 3, and you have vision screening, legal aid, hair care, medical screening. We help you apply for benefits. There's employment assistance. There's school registration, voter registration. It runs the gamut, but it's basically, it's kind of an opportunity for them to get everything they need under one roof.
Right.
And it also helps us to see who's out there, what they're looking for, and then we can get them into the coordinated entry system to start working on that housing and that permanent fix. So it's a really big day. Last year we served about 400 people. Our numbers decline every year. This is about our 7th year doing it. Which is good.
Yeah,
it means we're getting people off
it's
the
one
street.
Of those kind of, yeah, where it's good that you serve that many, but at the same time, it's like, well, we're trying to put ourselves out of business.
Right, exactly.
What would you say to those when you talk about just battling stereotypes and, I mean, you get to see this every single day. This is your world. And obviously, we're making progress, but there's still progress that needs to be made. What would you tell others in terms of who want to be involved in helping those who are homeless, who want to be involved in changing that mental shift? What would you say?
I think it's just about awareness. That's why they're not the homeless. It's someone experiencing homelessness. Being homeless doesn't define who you are. And every single person out there is just one crisis away from possibly being in the same exact situation. So there's just a lot of compassion that comes into it, and just knowing that it's just simply caring. having a conversation, figuring out what happened, figuring out why they're there, and then saying, okay, how can we get you out of this? How can we connect you to something that's going to help, you know, make a positive change in your life? And just making, you know, the one site, filling out the citing tool, that 2 seconds of filling it out and clicking submit, you know, 30 days later, they could be in their own apartment. They could be getting employment assistance. You know, we do rental assistance as well as employment assistance. So it's life-changing.
Tell them one more time the website, where to go.
It's CAFTH, Community Alliance for the Homeless, CAFTH.org. And the citing tool is right on our homepage. And when we have special events and volunteer opportunities, that's also right on our homepage.
Well, Dana, thank you for all you do. Appreciate you coming on the show.
Thank you for having me.
The Spark Awards annually recognize and celebrate individuals and organizations that have made outstanding contributions to the community. This year's recipient of the Education Educator Award is Tanya Mathis.
The College Campus Transition Program, known as CCTP, is administered by Shelby County Schools, Exceptional Children and Health Department, as well as partnered with the University of Memphis Institute on Disabilities. 7 years ago, both educational entities decided to collaboratively work together, and they added me to the team to facilitate as well as be the lead teacher for this program, or participants in the program. And I get to work with, and the program is for, students with intellectual disabilities, ages 18 to 22 years of age. These young people get to access the college and community environment, and they get to learn transferable work skills both on the University of Memphis campus and off. So, you know, in their preferred job settings. So I get to work with these young people to develop their work ethic, as well as teach them social, communication, independence, and you know, those vocational skills. It is so important to me because these young people, you know, most people deem them unreachable, and that 70% statistic states that these young people that exit out of high school typically enter into the job market and they're unsuccessful, leaving them unemployed, which means that they heavily rely on whatever government or state assistance that is, you know, made available to them. So, you know, I'm charged with the task to make sure that these young people, you know, that they are successful, because just like you and I, they have aspirations, they have goals. And so I have to make sure that I keep motivating them that they can do it.
And it's working. So when you look at the success you're having, placing the students in jobs, being successful, being productive, give us some of those kind of smiling stats, if you will, of just how the program's working.
Out of the 61 students that I have actually taught, 56 of those students have completed the program. And 64% of those young people are now employed or actually have gone on to continue their education. Now, to me, that's what growth looks like, because these young people, they're actually now employed and they're able to take care of themselves, some, their families, and they are contributing to the community. Now, that's awesome, and I'm just so happy to be a part of that. And you see the smile on that young person's face when they actually get an opportunity to go into a place of employment, or, you know, when they come back to you after they completed the program and tell you all of the other things that they're doing, such as getting their driver's license, or they've got their own car, their own apartment, whatever those things are. The little things to you and I are big things to them. You know, it is just amazing, because I always tell them, I said, you know, your disability is just one part of you. There are so many other parts of you. You're a whole person. And that's what our community have to realize, you know, to make sure these young people, give them an opportunity, because they can do the work.
They're a company famously known for their chicken, their hospitality, and their commitment to community. We have Anthony House, he's the operator for Chick-fil-A Germantown, and Kimberly Carlson, the area marketing director for Chick-fil-A Mid-South. 13 locations here in the Mid-South, but give us a history, because Chick-fil-A is all over the nation. Give us a little bit of history for Chick-fil-A.
Yeah. So Chick-fil-A is the #1 chicken chain in the U.S. and continuing to grow, actually experiencing some of our most explosive growth in the history of our company right now. We have 12 current locations in Memphis, with the 13th one about to open. And so we're excited about that, excited about how we can get involved in the community. Part of our corporate purpose is to be a faithful steward of all that's entrusted to us and to have a positive influence on all that come in contact with Chick-fil-A. And so we see that community outreach piece as just a natural part of who we are. And so we're always looking for those opportunities to get involved with the community.
Talk about one of the things, the please, the thank you, the hospitality, the manners. I mean, it's made national headlines, but it's something so simple yet so profound that I think it's ingrained, though, with Chick-fil-A.
Yeah. So, you know, it's a funny thing. So the whole My Pleasure is kind of what we're known for. And I was around when that came about. And it's kind of a neat story. Our founder, Truett Cathy, was staying at a Ritz-Carlton hotel, and at the front desk, they used My Pleasure. And he just thought, man, what a neat phrase. I think we should use that. And to be quite honest, and I'm just being transparent, when they first kind of rolled that out to us, that this was an expectation, I thought to myself, that'll never catch on. You know, that's kind of an archaic kind of thing. But we embraced it and did it, and then you just find it becomes second nature. And you sit there and you think about what that expression means, my pleasure. It just speaks to the joy that you get from serving others, and that's what service to others should be. It should come from a joyful heart, and so now we find we do that second nature. I even have 15-year-old kids that say, when I'm off work, I'm doing it, and people are pointing to me and say, you must work at Chick-fil-A. So
let's talk about commitment to community. I mean, this is a big part, Anthony, as you alluded to even at the opening, is you really immerse yourself. We work with tons of nonprofits. You use your food to give back. The restaurants give back. Your staff is out volunteering. You're inviting nonprofits to come in. I mean, all the way above, you have a really profound impact in terms of the community. Start with one being prom dresses is one. Let's start there. Let's start with the prom dresses and being an advocate, being a gathering place where people can drop off their prom dresses. Then ultimately, these young girls get to pick out a prom dress and have a magical night. So let's start there with her prom dress.
Sure. This is something where we did our third annual sponsorship of this year, and we provided a location, a convenient location to collect prom dresses for her prom closet, and we also served the young ladies food at the event, and the volunteers and the parents, and you know, we love to share a meal. You know, leading with food is one of our pillars, and we can do that with a special group who may or may not have shared Chick-fil-A or experienced Chick-fil-A. And what we bring in addition to a sandwich is that culture and that hospitality. And I think in the South, we can all appreciate just that joy that you do get in sharing a meal. So her prom closet is something that we're excited to partner with each year, and other community events that
well, I know like My Town Miracles is another
Sure.
one that you partner with. You have a huge family day and picnic, but it's out, you know, University of Memphis, kind of that Tiger Lane, but it's a huge field day with all sorts of activities and obviously food and fellowship and giving back as well.
Yes, that is this summer. We have a partnership with Tiger Athletics and the Redbirds, so whenever we can bring Rocky out or Pouncer and have them with our cows, you know, they meet up with the herd, and it's just like family to them. And Family Picnic has grown, so we moved it to Tiger Lane this year, and we're excited to have some of the student athletes and a family style picnic and a field day, just a full day of fun that will benefit My Town Miracles, who are making life-changing differences in our community, one miracle at a time.
And I know that on your end, Chick-fil-A Germantown, there's a number of special projects. So you have Chick-fil-A Mid-South that gets heavily involved. Each of the owners and operators, they get heavily involved. Talk about it from your standpoint, because I know there's a daddy-daughter dinner. I mean, there's a lot of really cool things that you guys do. Give us one of your favorites.
Well, so one of the things that we do out of our store, of course, we love the daddy-daughter date night. It's, you know, it's held at the zoo every year. My team gets to participate in that. They love the opportunity, and it's just it's a great event. It's usually the premiere night for the zoo lights. You know, there's Ferris wheel, carousel rides. hot chocolate, ice skating, a little of everything, and it's just that opportunity to treat that young girl or adult girl as a princess for the night. And so it's a neat thing. We're all about family. I know at our store personally, we have events that we also do that try to teach these young people the lessons of giving back to the community. So I think all of the stores kind of in their own way embrace market-wide events like Daddy-Daughter Date Night, but we also do some store-specific events.
So tell everyone where they can go, website, social media. When you talk about following Chick-fil-A Mid-South, where do we go to follow the efforts?
Sure. Our market page is a great way to also stay connected to the individual restaurants as well, but it's chickfilamidSouth.com is our website, and we are on Twitter and Instagram and Facebook at Chick-fil-A Mid-South, and on our Twitter feed is at Chick-fil-A Mim.
Anthony, Kimberly, greatly appreciate all you doing for coming on the show and sharing. Thank you.
Our pleasure.
Thank you. Appreciate it.
If you want to succeed, you need to have a plan. As we saw this month, the plan for success in our community takes on many forms and takes all of us doing our part to work together and to help each other. Church Health is using a unique model in a Memphis plan to leverage the donated services and expertise of doctors, physicians, hospitals, and laboratories to provide affordable health care to working uninsured people who might otherwise fall through the cracks. The Community Alliance for the Homeless provides the planning along the technical assistance and service coordination to public and private agencies who are working to end homelessness in Memphis and Shelby County. And companies like Chick-fil-A here in the Mid-South are not only teaching the values of good manners and a strong work ethic, they're using their teams, food, and facilities to help local nonprofits and make a difference with the plan of being a part of their customers' lives and communities in which they serve. When the plan is community service, we all win. Thank you for watching The Spark. To learn more about each of the guests, to watch past episodes, and to share your stories of others leading by example, visit WKNO.org and click on the link for The Spark. We look forward to seeing you next month, and we hope that you'll join with us in creating a spark for the Mid-South.
Just like having relevant and accurate information is necessary to make sound hiring and lending decisions, being engaged in our community is important. DataFax is proud to support the positives and be a sponsor of The Spark.
Lipscomb & Pitts Insurance is honored to serve the Memphis community for over 60 years. We've always focused on supporting our community and believe in promoting the positives, encouraging engagement, and leading by example. Lipscomb & Pitts Insurance is proud to be a presenting sponsor of The Spark.